Higgins.
Thank you, Madam Deputy Speaker. I rise to speak on the Dental Benefits Amendment Bill 2021. Madam Deputy Speaker, oral health is fundamental to overall health, well-being and quality of life. A healthy mouth enables people to eat, speak and socialise without pain, discomfort or embarrassment. The impact of oral disease on people's everyday lives is subtle and pervasive, influencing the way we eat, the way we work, the way we sleep and indeed our social interactions. The prevalence and recurrences of these impacts constitutes a silent epidemic if left untreated. Dental diseases lead to pain, discomfort and tooth loss and can lead to difficulties with chewing, swallowing and speech. Poor oral health can lead to problems with nutrition and general health, disruptions to sleep and productivity, and can be a barrier to full participation in society, including the ability to gain employment. Indeed, Madam Deputy Speaker, the National Survey of Adult Oral Health indicates that of the Australian population, 24% avoid food due to dental problems. That's 1 in 4 people. 20% experience regular toothache. 35% were uncomfortable about their dental appearance, and 24% rated their oral health as fair or poor. There are also links, Madam Deputy Speaker, between poor oral health and general diseases including type 2 diabetes and cardiovascular health. Most importantly, Madam Deputy Speaker, dental health is cumulative in nature, and poor oral health in childhood is a predictor of poor oral health throughout life. It's the great inequity of healthcare. Therefore, it's critical to ensure that young children have access to preventive dental care from an early age to give them the best possible chance of good oral health for life. That is why, Madam Deputy Speaker, I welcome the bill being debated here today. This bill amends the Dental Benefits Amendment Bill 2021 to remove the lower age eligibility restrictions of 2 years so that all children under 18 can access the scheme. Now, I know, Madam Deputy Speaker, from friends, colleagues and constituents how much they have enjoyed using the dental benefit scheme for their children, and I really welcome this extension to the under 2 age group. The amendment is based on the report of the 4th Review of the Dental Benefits Act 2008 and has been in consultation with stakeholders. The review committee included the Commonwealth Chief Medical Officer, representatives of the Australian Dental Association, Consumers Health Forum of Australia, private dental practitioners and dental advisors to the Department of Veterans Affairs and Department of Health, as well as Oral Health Services Tasmania, and stakeholders that were consulted including State and Territory Dental Health Services, Services Australia, the Federal Government Indigenous Health Division and academic dental professionals, which all agreed that if parents promote and practice good oral hygiene with their children from a young age, this will help in the prevention of more serious dental decay as their children grow up. It's a fact that is widely understood by the parents, experts and the community. And any parent who's tried to clean their kids' teeth when they're very young will understand how difficult that can actually be pragmatically. Madam Deputy Speaker, before the passage of this bill, eligible children aged between 2 to 17 years are currently entitled to access up to $1,013 in benefits for basic dental services, with benefits capped over 2 consecutive calendar years. This bill removes the minimum age of eligibility so that children under 2 years of age can access this scheme. Services that receive a benefit under the program include examinations, x-rays, cleaning, fissure sealing, filling, root canals extraction and partial dentures when necessary. Services can be provided in a public or private setting, but benefits are not available for orthodontic or cosmetic dental work. Madam Deputy Speaker, 1 in 3 Australian children experience tooth decay by the age of 5 to 6 years, and tooth decay is the leading cause of preventable hospitalisation in Australian children. Most people don't realise this, and it is actually quite extraordinary. And as a paediatrician, I worked with Professor Nikki Kilpatrick on a number of oral health initiatives, particularly for oral facial granulomatosis, which is an oral expression of Crohn's disease. And I know how difficult management of oral health is in young children. There are 3 key things that parents can do to look after their children's oral health. One of the most important ones is to reduce the amount of added sugar that they consume. They need to help their children to brush their teeth twice daily with fluoride toothpaste and to clean between the teeth, essentially to floss, and that they attend their dentist for regular dental checkups. Now, we know, Madam Deputy Speaker, that sugar in foods and drink are a major contributor to tooth decay today. Children aged 2 to 3 years of age, on average, eat 9 teaspoons of added sugar per day, and teenagers eat even more. They eat 20 teaspoons of added sugar per day. Madam Deputy Speaker, the World Health Organisation recommends reducing added sugar consumption to less than 6 teaspoons per day to minimise the risk of tooth decay, but also for obesity and type 2 diabetes. WHO is clear. Oral hygiene measures are important in preventing tooth decay and gum disease through the regular removal of plaque bacteria that causes disease. Guidelines also tell us fluoride in toothpaste helps to strengthen teeth to prevent tooth decay from starting, and it also helps to repair the early signs of damage to teeth. This is also why water fluorination and drinking tap water is also important. So don't just drink water in a bottle, make sure you drink tap water. We are lucky in Australia that most of our water is fluorinated. I'm of the age when growing up in country Victoria/New South Wales in Albury-Wodonga, our water was not fluorinated, and we had to take daily fluoride tablets as children. But, Madam Deputy Speaker, because of high sugar diets, dental disease still does occur, even though we have excellent rates of fluorination in Australia, particularly for those who use fruit juices early in life. Having worked in developing countries, I can tell you that fruit juice decay is simply awful and incredibly dangerous. Even when I worked in the United States, disadvantaged communities would give fruit juice in bottles to their toddlers, and these toddlers would come into hospital with completely black teeth. Unfortunately, parents did not know that sugar on the teeth of children is absolutely a solvent and can actually rot their teeth. And fruit juice is not as what actually people think. It has a lot of added sugar. It's just not declared in the way that you would think. So tooth decay in children progresses rapidly from an early lesion that can be reversed to a large cavity that might require extraction or worse, result in a nasty tooth abscess. Regular dental checkups, particularly in high-risk children, are important for early detection of disease and to ensure that appropriate prevention strategies and modifications to risk behaviour can be implemented. The Australian Dental Association recommend that a child's first dental visit should occur when the first tooth erupts, which is usually around 6 months of age, or by 1 year of age. Tooth decay in Australia has a strong social gradient, Madam Deputy Speaker, with a higher burden of disease amongst children whose parents are from vulnerable population groups, including those from Aboriginal and Torres Strait Islander identity, non-English speaking backgrounds, regional and rural areas, and low household income or educational background. The Medicare Child Dental Benefits Schedule provides vital funding to ensure that these vulnerable children are able to access necessary health care to help prevent and treat dental disease. However, the current eligibility requirements have until now prevented children under the age of 2 from accessing the scheme. It is estimated that around 20% of children already experience tooth decay by the age of 2 years, and many of those require irreversible treatment, often under general anaesthetic. This treatment is traumatic for the child and their parents and can contribute to longer-term issues of fear and anxiety, which can impact on future dental visiting patterns and risk of ongoing dental problems. I know, Madam Deputy Speaker, because as a child I had a serious and significant dental phobia, which meant I avoided going to the dentist for many years until I developed a tooth abscess. And then I quickly got over my dental phobia because the fear of the dental abscess and pain for the dental abscess was worse than the fear of going to the dentist. So I know how hard it is, but that's because in the old days there wasn't fluorination and we had many more dentist visits, and I know that now we're seeing much better dental health care. If this bill is passed, it will enable vulnerable children to visit the dentist from an early age and to avoid more complex treatment or hospitalisation for care and hopefully avoid dental phobia in the future. Unfortunately, only 56% of children aged 5 to 6 years have visited the dentist before the age of 5, and this decreases to 46% for children from low-income families. Financial cost is a major barrier to accessing dental care for many families, and the Child Dental Benefits Schedule provides an important mechanism to address this. And as we heard from the previous member, this bill will support 45,000 families to access dental services each year. It's something that we should all be proud of throughout the House, because this is about children's future. A recent study investigated the impact of COVID-19, however, Madam Deputy Speaker. We do know that dental services have taken a real hit because people have been locked down and unable to access dental health care. And it's something I'd just like to comment on in the last few minutes that I have, because we know that during the March to September 2020 period in Victoria, there were 881,000 fewer dental services provided in 2020 than in 2019, a reduction of 27%. There was also a great decline in preventive and diagnostic services. So, Madam Deputy Speaker, dental practices in my home state of Victoria in particular have gone through 6 periods of restriction on their ability to provide dental services since the pandemic began, with nearly 6 months in the last 18 months where patients were restricted to mostly urgent or emergency dental care only. The COVID pandemic has had a significant impact on the provision of dental services, in particular to children from low socioeconomic backgrounds who already experience high levels of dental disease and disadvantage in accessing their dental care. So, in concluding, for those listening, please don't delay your dental checkup. Your teeth are some of your most important health assets. That is why I support the amendment, and that is why it's so important. I commend this bill to the House. Thank you, Madam Deputy Speaker.
And I thank the member for Higgins for her contribution.